Hello, everyone. I'm here to present to you Into the Future, Biomedical HIV Prevention. The world has set an ambitious goal to end AIDS by 2030. Despite the tremendous progress in HIV response, adolescents and youth remain at high risk of HIV infections, especially in sub-Saharan Africa, the epicenter for HIV and AIDS. AIDS continue to be one of the leading causes of death among young people aged 10 to 24 in Africa and second leading cause globally. I come from the United Republic of Tanzania, where 2.2% of young people aged 15 to 24 are living with HIV. Out of 72,000 new HIV cases a year, 40% are young people aged 15 to 24, with 80% being female. New cases continue to arise despite the effort put by government to reducing new HIV infections among young people. This speaks to the fact that perhaps we are not meeting all their needs. Through engagements I do with communities, including adolescents and young people, here are some of the reasons to why we still have rising cases of HIV infections among this group. Low HIV and sexual health knowledge, including comprehensive sexuality education. Despite low interest, there is also incorrect and inconsistent use of condoms among young people. There's also limited HIV prevention options, given not everybody can use condom or abstain to prevent themselves from HIV. So there's a need for new HIV tools and expanding the existing options. There are other factors surrounding young people in our communities that in one way or the other put them at high risk of HIV infections, including gender-based violence. This goes all the way down to different realms of GBV, including economic, intimate partner violence, emotional, and physical violence. Existing HIV prevention interventions have not done enough to stop HIV infections among adolescents and youth. For the world to end AIDS by 2030, considerations must be made to combination HIV prevention. This includes biomedical HIV interventions such as oral pre-exposure prophylaxis, behavioral interventions such as condom use, and structural interventions which include policies and environments that enable easy access to HIV services for young people in our countries. In this slide, I would like to talk about biomedical HIV prevention. This involves approaches or interventions that include medicines or are medically based. For the past 2 decades, a number of new biomedical options have been investigated and advanced. Some are still in development and require more research, and some are already available and recently proven by research, such as pre-exposure prophylaxis, oral PrEP. I'll continue to mention other biomedical HIV prevention options, including the existing evident ones, such as HIV testing, including the advanced self-testing, the new approach that we are having at the moment, condoms, voluntary male medical circumcision, prevention of mother-to-child transmission, and treatment as prevention. We also have diverse option now in terms of pre-exposure prophylaxis, including daily oral PrEP, a pill a day that can prevent an HIV negative person from getting infected. The dapivirine vaginal ring, which releases dapivirine into the vagina that slowly slowly released to prevent vaginal transmission of HIV infections, as well as long-acting injectable pre-exposure prophylaxis, cabotegravir. We also have prevention interventions in research pipeline, including antibody-mediated prevention, vaccines, both preventive and curative, as well as long-acting and short-acting microbicides. Of all those mentioned biomedical HIV prevention interventions existing and underway, the most exciting thing for me includes having numerous diverse options to pick from. We're moving from a world where we had limited HIV prevention options, and now we have oral pre-exposure prophylaxis and the recently added dapivirine ring into the prevention basket. We also have multi-purpose prevention technology underway, which looks at an end user as a whole. Instead of taking different HIV prevention interventions and contraceptive interventions, we now are looking into having tools that can prevent more than one issue, more than one item at the same time. For instance, we could be having a pill that prevents both HIV infections as well as pregnancy, or having a vaginal ring that can prevent pregnancy, STIs, and HIV infections, to mention. Despite all these exciting tools mentioned, we still have limitations, especially in the way that these products or tools are being introduced and adopted in our countries. There's a level of unpreparedness of countries to adopt to research advancement, forgetting that HIV infections do not wait. So it's necessary to adopt new tools as soon as it's convenient. There's also an existing gap between communities, implementing partners, and researchers regarding ongoing HIV biomedical clinical trials, making it difficult when it's time for introducing new tools, because communities are far left behind in terms of knowing and understanding how these tools work. But also, there's an existing big issue at the moment, the COVID-19 pandemic, that has in some way caused attention shift in terms of resources, but also slowing down progress made towards ending AIDS, especially in research as well. To wind up my presentation, here are my key messages to you. It's essential for countries to apply a strategic mix of structural as well as biomedical and behavioral approaches that are required to meet the needs of adolescents and youth, focusing both on their immediate risk and underlying causes of vulnerability. It's necessary to also ensure a conducive policy and legal environment to eliminate barriers to introducing new biomedical HIV prevention, care, and treatment tools. National AIDS authorities, program managers, and AIDS advocates must prepare for eventual adoption of new biomedical HIV prevention, care, and treatment tools in advance as well. There's a need for full, meaningful engagement of affected youth in our communities in ending AIDS, from planning, resource mobilization, to execution of programs targeting adolescents and youth. Young people must also be informed of the ongoing clinical trials in the most friendly way possible for them to understand and gain interest in terms of following up and eventual uptake of the services. There's a need for sufficient coverage of primary prevention programs reaching young people in their diversity, including young, key, and vulnerable populations at risk, to reduce the numbers of new HIV infections. And last but not least, it's necessary to strengthen national HIV prevention leadership and capacity with young people at the forefront and center of the movement. Thank you so much.